Question 1. A community health nurse is conducting a windshield survey. Which observation provides the most meaningful assessment data about community resources? A. Counting the number of trees in the neighborhood. B. Observing the availability of grocery stores and clinics. C. Recording the color of houses. D. Listing the brands of cars parked on the street. Answer. B. Observing the availability of grocery stores and clinics. Rationale. Windshield surveys assess community resources, services, safety, and environmental conditions. Observing availability of essential services, like clinics and grocery stores, provides crucial assessment data. Tree count, house color, and car brands do not contribute to meaningful community health assessment. Question 2. A nurse is developing a community health education program focused on reducing adolescent smoking rates. Which action demonstrates the use of primary prevention? A. Conducting lung cancer screenings. B. Teaching student strategies to resist peer pressure. C. Providing nicotine replacement therapy. D. Managing symptoms of chronic obstructive pulmonary disease. Answer. B. Teaching student strategies to resist peer pressure. Rationale. Primary prevention aims to prevent disease before it occurs. Teaching students resistance strategies targets behavior change before smoking starts. Screenings are secondary prevention. Treatment and symptom management are tertiary. Question 3. During a measles outbreak, which action by the community health nurse reflects secondary prevention? A. Administering MMR vaccines to children. B. Identifying and testing individuals exposed to the virus. C. Providing rehabilitation for complications. D. Creating public billboards on measles symptoms. Answer. B. Identifying and testing individuals exposed to the virus. Rationale. Secondary prevention focuses on early detection and prompt treatment. Testing exposed individuals fits this level. Vaccination is primary. Rehabilitation is tertiary. Public information is primary. Question 4. A community health nurse is applying the epidemiologic triangle to analyze a rise in foodborne illness. What is an example of the environment factor? A. The bacteria contaminating the food. B. The contaminated chicken consumed. C. Improper refrigeration at a local restaurant. D. The immune status of community members. Answer. C. Improper refrigeration at a local restaurant. Rationale. The epidemiologic triangle includes agent, host, and environment. Improper refrigeration is an environmental factor enabling disease spread. Bacteria is the agent. Contaminated chicken is a vehicle. Host immunity relates to the host. Question 5. A home health nurse visits an older adult who lives alone and has heart failure. Which finding requires the nurse's immediate intervention? A. The patient has only canned foods available. B. The home temperature is 32 degrees Celsius 90 degrees Fahrenheit. C. The patient reports mild ankle swelling. D. The patient stores medication in a kitchen cabinet. Answer. B. The home temperature is 32 degrees Celsius 90 degrees Fahrenheit. Rationale. High temperatures increase fluid loss and cardiac workload, posing immediate danger for heart failure patients. Canned food, mild swelling, and cabinet storage are concerns, but not emergencies. Question 6. A nurse working in occupational health identifies which situation as the highest priority? A. Employees not wearing ear protection in noisy areas. B. Staff reporting occasional back strain. C. Workers requesting flu vaccinations. D. Employees asking for ergonomic keyboard adjustments. Answer. A. Employees not wearing ear protection in noisy areas. Rationale. Noise exposure can lead to permanent hearing loss, making it an urgent safety risk. Back strain vaccinations and ergonomic needs are important, but not immediately harmful. Question 7. The nurse is planning disaster preparedness training for a community. Which topic is most essential to include? A. How to create scrapbooks during emergencies. B. How to prepare a 3-day emergency supply kit. C. How to design community newsletters. D. How to paint evacuation shelters. Answer. B. How to prepare a 3-day emergency supply kit. Rationale. Having essential supplies for 72 hours is a core element of disaster readiness. Other options are irrelevant to emergency preparedness. Question 8. A community health nurse is advocating for a policy to reduce air pollution. This action best represents which role? A. Case manager. B. Advocate. C. Clinician. D. Educator. Answer: B. Advocate. Rationale. Advocating for policy change is a direct example of the advocacy role. Case management coordinates care. Clinicians provide direct services. Educators teach individuals or groups. Question 9. A community health nurse conducts a needs assessment. Which steps should the nurse take first? A. Implement interventions. B. Evaluate outcomes. C. Collect data about the population. D. Select community partners. Answer: C. Collect data about the population. Rationale. The first step of a community needs assessment is gathering data to understand the population's problems and resources. Intervention and evaluation occur later. Selecting partners happens after initial data collection. Question 10. A nurse notices a rise in asthma cases among children living near an industrial zone. Which action demonstrates evidence-based practice? A. Relying only on personal experience. B. Avoiding collaboration with environmental agencies. C. Reviewing research on pollution-related asthma and implementing community education programs. D. Asking families to ignore environmental triggers. Answer: C. Reviewing research on pollution-related asthma and implementing community education programs. Rationale. Evidence-based practice integrates research findings, clinical expertise, and community needs. Option C reflects these principles. The other options disregard evidence and safety. Question 11. A community health nurse is analyzing epidemiological data showing a sudden increase in opioid overdoses in a specific neighborhood. Which initial action demonstrates the most appropriate use of community-level surveillance? A. Educate school children about drug refusal techniques. B. Collaborate with EMS to track overdose hotspots in real time. C. Provide counseling to individuals recovering from addiction. D. Advocate for long-term mental health funding. Answer: B. Collaborate with EMS to track overdose hotspots in real time. Rationale. Surveillance requires rapid data collection and pattern tracking. Working with EMS provides real-time, location-specific information. Education and counseling are interventions, not surveillance actions. Advocacy is long-term and not an initial response. Question 12. A public health nurse must allocate limited vaccines during an outbreak. Which decision best reflects ethical justice in resource distribution? A. Vaccinate individuals who arrive first. B. Prioritize politicians to maintain government stability. C. Vaccinate high-risk groups based on morbidity and mortality data. D. Offer vaccines only to those who can pay. Answer: C. Vaccinate high-risk groups based on morbidity and mortality data. Rationale. Justice requires fair distribution using evidence-based criteria. Prioritizing high-risk groups is ethically and scientifically justified. First-come, favoritism, and payment-based distribution violate ethical principles. Question 13. A community health nurse is evaluating the effectiveness of a multi-phase diabetes prevention program. Which outcome best demonstrates successful tertiary prevention? A. Increased attendance at nutrition classes. B. Increased screening for prediabetes in adults. C. Decreased rate of foot amputations among diabetic clients. D. Higher sales of healthy foods in stores. Answer: C. Decreased rate of foot amputations among diabetic clients. Rationale. Tertiary prevention focuses on reducing complications and disability. Preventing amputations directly reflects tertiary-level outcomes. Screening is secondary. Nutrition classes and healthy food sales relate to primary prevention. Question 14. A nurse is assessing environmental risks after residents report increased respiratory symptoms. Which finding indicates the strongest need for an environmental health investigation? A. Multiple families use wood stoves. B. Residents report a petroleum odor after rainfall. C. Houses are located near a busy playground. D. Residents have seasonal allergies. Answer: B. Residents report a petroleum odor after rainfall. Rationale: a petroleum smell after rainfall suggests contamination of soil or groundwater, an urgent environmental hazard requiring immediate investigation. Wood stoves and playgrounds are typical community features, and allergies are common and not necessarily linked to contamination. Question 15. A nurse is coordinating a multi-agency response to a chemical plant explosion. Which task demonstrates the nurse's role in ICS, Incident Command System? A. Providing first aid directly to clients. B. Supervising volunteer groups without communication protocols. C. Assigning roles and ensuring interagency communication. D. Creating social media updates without approval. Answer: C. Assigning roles and ensuring interagency communication. Rationale: ICS emphasizes clear chain of command, role assignment, and communication. Direct care may be delegated. Unsupervised volunteers and unapproved messaging violate ICS structure. Question 16. A nurse is working with epidemiologists during a tuberculosis cluster investigation. Which action represents analytic epidemiology? A. Mapping the households of all TB-positive cases. B. Conducting interviews to identify exposure patterns. C. Comparing TB rates between smokers and non-smokers. D. Distributing masks in high-risk areas. Answer: C. Comparing TB rates between smokers and non-smokers. Rationale: analytic epidemiology tests hypotheses and identifies cause and effect associations. Comparing groups fits this. Mapping and interviews are descriptive epidemiology. Mass distribution is an intervention. Question 17. During a community assessment in a rural area, the nurse finds high rates of uncontrolled hypertension and limited access to care. What should the nurse do first? A. Implement group hypertension clinics. B. Develop telehealth monitoring programs. C. Identify community barriers and resources related to care access. D. Provide free home blood pressure cuffs. Answer: C. Identify community barriers and resources related to care access. Rationale: a thorough assessment is required before interventions. Identifying barriers, transportation, provider shortage, cost, guides effective planning. Jumping to interventions without understanding root causes risks failure. Question 18. A community health nurse is planning interventions to reduce childhood lead exposure. Which intervention demonstrates primary prevention at the population level? A. Screening children under 6 for lead levels. B. Removing lead paint from older housing units. C. Providing chelation therapy for high lead levels. D. Monitoring developmental delays caused by lead. Answer: B. Removing lead paint from older housing units. Rationale: primary prevention eliminates the source before exposure occurs. Screening is secondary. Chelation and monitoring are tertiary. Question 19. During an emergency, the nurse must use Start Triage. Which client should the nurse tag as red immediate? A. A client who can walk but has minor abrasions. B. A client with a respiratory rate of 34 and unresponsive to voice. C. A client crying with a fractured arm. D. A client with no breathing after airway repositioning. Answer: B. A client with a respiratory rate of 34 and unresponsive to voice. Rationale: Start Triage immediate includes those with compromised airway or breathing, mental status, or perfusion but still salvageable. No breathing after repositioning equals black. Walking wounded equals green. Fractured arm equals yellow. Question 20. A community health nurse is implementing an evidence-based smoking cessation program but encounters resistance from a cultural group that practices ceremonial tobacco use. What is the most appropriate action? A. Ignore the cultural practices and proceed. B. Adjust the program to respect ceremonial use while addressing harmful patterns. C. Ask the community to stop all tobacco use. D. Provide only written materials to avoid discussion. Answer. B. Adjust the program to respect ceremonial use while addressing harmful patterns. Rationale. Culturally competent care respects cultural practices while promoting health. Ignoring culture undermines trust. Demanding elimination of ceremonies is disrespectful. Avoiding discussion prevents meaningful engagement. Question 21. A cluster of severe gastrointestinal illness is reported across 5 schools within 2 days. The community health nurse begins an epidemiologic investigation. Which action should the nurse perform first to determine the outbreak source? A. Conduct stool testing on every affected student. B. Create an epidemic curve to analyze the pattern over time. C. Close all school cafeterias immediately. D. Start mass antibiotic administration. Answer. B. Create an epidemic curve to analyze the pattern over time. Rationale. The first step in outbreak investigation is defining cases and plotting an epidemic curve. This reveals incubation periods, exposure windows, and outbreak progression. Testing, closures, and antibiotics occur after the pattern is understood. Question 22. After a factory explosion releases an unknown vapor, multiple clients arrive at a community triage site complaining of dizziness, wheezing, and blurred vision. Which action should the community health nurse prioritize according to hazmat protocol? A. Begin immediate IV access. B. Move clients to a warm zone for gross decontamination. C. Apply high-flow oxygen before decontamination. D. Initiate field intubation for all symptomatic workers. Answer. B. Move clients to a warm zone for gross decontamination. Rationale. Hazmat protocol requires decontamination before medical treatment, except life-saving airway interventions. Giving oxygen or intubation before decontamination risks secondary contamination. IV access is also delayed until decontamination is complete. Question 23. A community experiences a spike in Legionnaire's disease. Water sampling data show increasing bacterial counts in cooling towers across 3 buildings. What should the nurse recommend first? A. Begin prophylactic antibiotics for all building occupants. B. Shut down the cooling towers and initiate immediate disinfection. C. Publish a public warning without taking control measures. D. Test all surrounding lakes and ponds for contamination. Answer. B. Shut down the cooling towers and initiate immediate disinfection. Rationale. Cooling towers are the primary source of Legionella aerosols. Immediate shutdown and disinfection stops exposure. Antibiotics for all is inappropriate. Lakes or ponds are not typical sources. Public warnings must accompany action, not replace it. Question 24. A nurse analyzes post-disaster morbidity data showing that 60% of injuries occurred due to delayed evacuation during a wildfire. What strategy should the nurse implement to reduce mortality in future events? A. Increase ambulance staffing. B. Develop community-wide early evacuation education and drills. C. Train residents in basic first aid. D. Provide more hospital beds for burn victims. Answer. B. Develop community-wide early evacuation education and drills. Rationale. Data show the root cause was delayed evacuation. Prevention requires early warning systems and drills, not more ambulances or hospital beds. First aid training won't reduce evacuation delays. Question 25. A community health nurse reviews surveillance reports showing a steady rise in multi-drug-resistant tuberculosis, MDR-TB. Which intervention is most appropriate for preventing further transmission? A. Increase funding for new hospital buildings. B. Expand directly observed therapy (DOT) programs. C. Reduce screening because MDR-TB is already widespread. D. Provide masks only to symptomatic individuals. Answer. B. Expand directly observed therapy (DOT) programs. Rationale. DOT ensures treatment adherence, preventing continued transmission and resistant strain development. New buildings are irrelevant. Reducing screening worsens spread. Masks only for symptomatic clients is inadequate. Question 26. A refinery explosion has overwhelmed regional hospitals. As part of ICS operations, the community health nurse is assigned as Operations Section Chief. Which task falls under this role? A. Approve public media statements. B. Direct tactical response units and coordinate field operations. C. Oversee financial tracking and documentation. D. Develop long-term recovery policy statements. Answer. B. Direct tactical response units and coordinate field operations. Rationale. The Operations Section Chief manages tactical actions, resources, and direct response units. Media statements belong to Public Information Officer. Finance or administration and planning roles are separate. Question 27. A community health nurse receives data indicating the attack rate of food poisoning was significantly higher among individuals who ate potato salad than any other food. What epidemiologic conclusion is most accurate? A. Potato salad is statistically associated with the illness source. B. All foods must be equally suspected. C. Attack rate is not useful in foodborne investigations. D. The outbreak is unrelated to food consumption. Answer. A potato salad is statistically associated with the illness source. Rationale. A disproportionately high attack rate for one food suggests it is the likely vehicle for infection. Other foods are less likely sources. Attack rate is essential in outbreak investigations. Question 28. A community nurse is analyzing the shape of an epidemic curve that shows repeated waves of infection occurring every 10 to 12 days. What does this most likely indicate? A. A point source outbreak. B. A continuous common source outbreak. C. A propagated person-to-person outbreak. D. A non-infectious chemical exposure. Answer. C. A propagated person-to-person outbreak. Rationale. Repeated waves spaced by incubation periods indicate person-to-person transmission. Point source and continuous outbreaks look different. Chemical exposures do not generate infection waves. Question 29. During a heat wave, mortality increases sharply among older adults living alone. Which intervention should the community health nurse implement first? A. Develop public posters about heat stroke. B. Establish an emergency cooling center transportation program. C. Conduct a 6-month research study on heat trends. D. Write a grant proposal for new air conditioners. Answer. B. Establish an emergency cooling center transportation program. Rationale. Older adults living alone need immediate access to cooling centers. Posters are insufficient. Research and grants take too long and do not address urgent mortality. Question 30. After a bioterrorism-related anthrax release, the nurse must determine who receives prophylactic antibiotics first. Data show the highest exposure occurred within a 5 kilometers radius from the release site. What should the nurse prioritize? A. Entire county. B. Individuals within the 5 kilometers highest exposure radius. C. Only symptomatic individuals. D. Health workers only. Answer. B. Individuals within the 5 kilometers highest exposure radius. Rationale. Prophylaxis is prioritized for individuals with highest exposure risk. Only treating symptomatic individuals is too late, and limiting to health workers or entire county misallocates resources. Question 31. A community health nurse is analyzing cholera outbreak data. Which finding most strongly indicates the outbreak is waterborne? A. Cases occur evenly across the population. B. Cases cluster around a specific water source. C. Fever is present in all clients. D. Cholera cases increase after community gatherings. Answer. B. Cases cluster around a specific water source. Rationale. Clustering around a water source strongly supports waterborne transmission. Equal distribution suggests random exposure. Fever patterns and gatherings do not confirm waterborne disease. Question 32. During a measles outbreak, the nurse must predict when new cases will peak. Which data point is most critical to calculate? A. Mortality rate. B. Incubation period. C. Cost of treatment. D. Total number of vaccinated individuals. Answer. B. Incubation period. Rationale. Predicting peak case onset requires knowing incubation period to project secondary waves. Mortality, cost, and vaccination data are useful but not for timing. Question 33. Floodwater contamination causes widespread diarrhea. Which population should the nurse prioritize for immediate clean water distribution? A. Young adults. B. Older adults living alone. C. Pregnant individuals and children under 5. D. High-income households. Answer. C. Pregnant individuals and children under 5. Rationale. These groups are most vulnerable to dehydration and infection. Prioritization is based on physiologic vulnerability, not age alone or socioeconomic status. Question 34. A nurse reviews data showing that an influenza strain has an R0 basic reproductive number of 5. What does this indicate? A. Each infected person infects 5 others on average. B. The disease is not contagious. C. The outbreak will resolve without intervention. D. The virus cannot cause a pandemic. Answer. A. Each infected person infects 5 others on average. Rationale. R0 reflects transmissibility. An R0 of 5 indicates high spread potential. The other options contradict the definition. Question 35. Multiple emergency shelters report medication shortages after a tornado. According to ICS, who should the nurse notify first? A. Finance or Administration Section Chief. B. Operations Section Chief. C. Logistics Section Chief. D. Planning Section Chief. Answer. C. Logistics Section Chief. Rationale. Logistics manages supplies, equipment, and resource distribution. Operations focuses on direct actions. Planning organizes information, and finance handles costs. Question 36. A nurse analyzes data, revealing that 70% of asthma-related hospitalizations occur in homes located within 1 kilometer of a major highway. Which intervention is most appropriate? A. Provide free rescue inhalers to all residents. B. Establish air filtration programs and environmental modifications for affected homes. C. Conduct asthma classes for the community. D. Tell families to avoid going outdoors. Answer. B. Establish air filtration programs and environmental modifications for affected homes. Rationale. The root cause is environmental exposure. Mitigating exposure through filtration and modifications is evidence-based. Inhalers address symptoms, not cause. Classes and avoidance alone are insufficient. Question 37. A norovirus outbreak occurs in a nursing home. Attack rates by floor show: floor 1, 3%, floor 2, 78%, floor 3, 5%. What should the nurse conclude? A. Staff transmission is evenly distributed. B. The source is likely located on the second floor. C. Floors 1 and 3 require isolation first. D. The outbreak is unrelated to location. Answer. B. The source is likely located on the second floor. Rationale. Extremely high attack rate on one floor indicates the contamination source is located there. Transmission is not even. Location clearly matters. Question 38. During a chemical spill, field personnel become symptomatic despite following protocol. What should the nurse do first? A. Begin advanced cardiac life support. B. Stop all field operations and reassess PPE adequacy. C. Rotate personnel to reduce fatigue. D. Evacuate only the symptomatic workers. Answer. B. Stop all field operations and reassess PPE adequacy. Rationale. If responders become symptomatic, PPE is insufficient and operations must stop to prevent further harm. ACLS and evacuation occur after ensuring scene safety. Rotation does nothing if PPE is inadequate. Question 39. A community shows rising rates of opioid overdose clusters every Friday night. What should the nurse prioritize to reduce mortality? A. Increase weekend naloxone distribution sites. B. Conduct weekday coping skills workshops. C. Develop a 5-year research initiative. D. limit EMS staffing on weekends? Answer. A. Increase weekend naloxone distribution sites. Rationale. Clusters occur Friday nights, requiring immediate targeted access to reversal agents. Workshops and research do not address urgent mortality. Reducing EMS staffing worsens outcomes. Question 40. A regional shelter receives sudden reports of severe vomiting in 35 evacuees. Data show all affected individuals consumed sandwiches from the same shipment delivered earlier that day. What should the nurse do first? A. Begin widespread antiemetic distribution. B. Isolate contaminated food sources and stop distribution immediately. C. Call for additional shelter volunteers. D. Evacuate the entire shelter. Answer. B. Isolate contaminated food sources and stop distribution immediately. Rationale. Stopping further exposure is the immediate priority. Treating symptoms comes after preventing new cases. Volunteers and evacuation are unnecessary unless contamination spreads. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.